Okay, good morning, everybody. Welcome to the Sedgwick County Staff Meeting for July 14, 2020. Tom Stoltz.
Good morning, Chairman and Commissioners. A couple things on the list of discussions today. Judge Gehring is here from the 18th Judicial District to give us an update on the challenges that courts are facing. Then we have our general COVID discussion, and unfortunately there's a lot to talk about this morning regarding the infection and some of the numbers that we're seeing. So we'll go through the website, the dashboard. Tim will talk about some of the challenges in testing, and then Adrian will bring up the rear on anything that we need to have cleaned up as far as data. But before we start that, I wanted to bring up today and that it's the chairman's birthday. And in 2020, we all are aging by dog years. So that's 7 years for one. So yeah, that puts you in your young 70s, I think, sir. So just a happy birthday from your staff and from the county, and optional if the commission wants to sing, but if not, we have plenty of work to do. So
Thanks, Tom.
Happy birthday, sir.
It'll go down as a memorable birthday year for sure.
Your COVID birthday, just like the rest of us get, right?
Yes.
All right, Judge, you've got the podium, sir.
No. Judge, good morning.
Good morning. Thank you for having me.
Commissioner Dennis said that I had hair like you when I first started this.
Well, I keep getting pinged by Eric Fisher. They want me back, so.
There you go. All right. Anyway, good morning. And
Good morning. I know all of you can't help but notice the traffic plaza that we have most mornings.
Mm-hmm.
We have our traffic department out in the front of the courthouse on Mondays, Tuesdays, and Fridays, and that started mid-June, and so we've got about 30 days of progress that we can report on. The total we've resolved since we've been doing this out on the plaza, about 729 traffic cases have been taken care of out on the plaza, outside. These are people that were able to resolve their cases in a way that didn't require them to come into the courthouse. And so far, I think it's looking good. In addition, we had 856 cases that were resolved in the traffic department by people either phoning in, logging on, paying their fines, paying their tickets. So I think that good. It's oftentimes nice to bring some good news to the commission, and I think this has been a success. My concern is that this exercise that we're doing, we had planned on doing this through the end of July, so we're starting to come towards the end of that. And I don't know that we have a place to run the traffic department consistent with social distancing and consistent with the number of people that can be in one space at one time. All of you have seen the 5th floor traffic courtroom. Before this pandemic came, it was already a compressed, cramped place. The hallways were always overflowed with people, when traffic was meeting. And although we've had great success out front, I suppose I'm meeting with the traffic team in Ellen later on this morning. We can talk about extending traffic on the plaza, but at some point in time that's going to have to come to an end, either by weather or it just can't. It's just not a permanent solution. So I don't know. I know that Ellen has proposed, and I've suggested to some that there may be some creative use of COVID funds that are available to y'all. If there was a way that we could quickly establish traffic on a different floor with COVID funds, that would be a way to solve one of our COVID-related problems. Would be able to solve the space problem, and I think it's something to think about because it's a benefit that the courthouse will have long after this is in our rearview mirror. So something to think about. Just sort of on a related space issue, just to kind of put this on your radar, we have, as you know, a open Court of Appeals vacancy that the Senate did not confirm the governor's appointment, so the governor replaced the unconfirmed person with another, or the panel replaced that person with someone else. So now the three candidates are all Wichita lawyers. So we're going to have a Wichita replacement to the Court of Appeals. It's just a question of which of the three. I don't know whether that judge will want to office here or office in Topeka, or haven't had any conversations one way or the other, but just one of those things to put on your radar and to think about in terms of space. That issue may be coming sooner rather than later. I'm happy to answer any questions you may have about the court and about traffic and anything else, but that's my presentation.
Commissioner Cruz.
Thank you, Chairman. What's the lowest level traffic offense that you guys handle?
Well, the lowest would be, speeding related tickets, things like that. Those tickets, for the most part, are either handled by people simply mailing in their ticket with the guilty plea marked and a check, or they can take care of those things online. Really, the traffic isn't being generated by those sorts of traffic offenses, because I think for the most part those offenses are taken care of by people, either mailing them in or not coming to the courthouse.
So is there like what creative ways have you guys, outside of putting people outside? I mean, are there other cases that you could determine whether they could be taken care of in a different way?
Well, I'm happy to look at that, but the more serious traffic offenses require court appearances. So they're summons to court, and it's something that usually they're trying to. I suppose they could come to court and plead guilty, but a lot of times what people want, for example, you are driving without insurance. You have insurance, you just didn't have proof of insurance in your car. Well, you're not going to want to just plead guilty to that. You want to come downtown, show the DAs that you have proof of insurance, they verify that, and then they dismiss the ticket. So I suppose some of that could be handled out of the courthouse. The prosecutors would probably have better answer for that than I, because that's the interaction that they have with the prosecutors. In other instances where you have somebody driving on a suspended license, they're eligible to have their license reinstated. They just need to pay a ticket, or they need to get insurance, or they need to do this or that. And typically, oftentimes the DAs will give them opportunities to do that, but it requires them showing up in court, telling them, okay, well, this is the progress that I'm making. They're just not going to hand out a continuance just because. So I suppose that there is creative thinking that we could employ to see if the same level of appearance is required, but I think that we've pretty much harvested most of the low-hanging fruit.
Okay, thank you.
Commissioner Dennis.
Thank you, Mr. Chairman. Well, I appreciate Ellen took me a tour of the 5th floor the other day, and along with Tanya. And there is a problem up on the 5th floor. There's no way that I could see that you're going to be able to hold traffic court up there during the COVID crisis. So we're going to, as I said, have to start becoming a little bit agile in how that we do business in the future, and look for new and innovative ways of handling the traffic court. So I think our staff, that's why Tanya was with us, is so that our staff could take a look at some different options. And I realize that we can't continue with tents out front, as we're going to have 100-degree weather here in the near future, and then eventually it's going to get cold. So we need some innovative way of doing this, and I know that our staff is working that, so I appreciate the fact that Ellen took me up there to show me what's going on.
You bet. We're happy to, anybody else that would like a 50-cent tour, we're happy to give them to you.
Commissioner Howell?
Thank you, Mr. Chairman. I'm curious, since this is a kind of a temporary situation immediately, and it sounds like you have a desire to have a long-term solution, but the courthouse obviously is space limited. And to find any other space in this building right now seems a little unlikely. And if you do displace something else to expand your traffic court, something else is going to be hurt. So
Very
you
true.
haven't really talked about that this morning that I'm aware of. So I'm just curious, what are you going to be displacing that's going to have additional pressure then as a result of moving traffic court?
Sure, and, we've submitted our space plan, and I guess the thought is that to the extent that any of that space plan can be accelerated, with the use of COVID funds, then these are improvements that are gonna have to be done sooner or later, but they're improvements that are done off budget. I mean, they're improvements done with grant money that we're getting from the feds, and it is COVID related, at least with respect to the traffic department. So, it's an idea that I throw out there. I understand that there are more moving parts than what I'm suggesting, and that, for us to go someplace else means that whoever's there's got to go someplace, and those are the pieces of the puzzle that I just, I'm happy to be part of the discussion. I don't have any answers to that, though.
I guess I'm wondering if you looked at any other solutions, like maybe some temporary space nearby that would be something
Yes.
we could get for just a short time, anything like that?
Well, we have, and one of the challenges there is logistics. The prosecutors have their hardware, their computers, their access to the clerks. Moving all of that off-site would be a challenge, something that we could certainly look at and consider, but it is something that we've given thought to. That's a more complicated problem, which is one of the reasons why we landed on tents in front of the courthouse, because it's so much easier. You're still within the range of the Wi-Fi in the court building. You have power outlets out there. You're still pretty close. Frankly, it's something that has been used by other court departments. The trustee's office used it a couple of days, I think, a week or two ago, to clear back child support cases, and it's an amazing use of that space. But moving it all off-site would be more challenging.
In some places, they've gone towards, if you have to actually confer with the judge during the proceedings or whatever, some places have kind of gone towards Zoom-like meetings. Have we done any of
Yes.
that?
Yeah, we are. We're doing Webex hearings. The Supreme Court has encouraged that. It's so much of traffic right now is, we're advertising on the radio for people to come in and take care of their tickets. So they're going to have to make contact with the court in some form or fashion to be able to set up a Webex hearing, to be able to say, okay, well, we're going to be at this spot and this time, and create a docket. This is what we're having out front is more of a walk-in docket. But yeah, judges are making use of Webex hearings, and I think Judge Woods is making use of Webex hearings to the best that he can.
So in that case, would the defendant be, if you will, at their own home, and the judge would be here in their office? How does that work?
Typically, they're wherever they are. If they have an access to an iPhone or an iPad, you can have the hearing wherever that person is that can log on and can participate. So we've had those where defendants or passengers in the car, participating with their iPhone, or maybe they're at home, or they're at a restaurant someplace. But
I guess I'm wondering, some people don't have access to those types of devices and tools, and so I thought maybe maybe we ought to be looking at potentially, we set up a space for them to go to. We could access virtually the proceeding, but they would not be in this building.
yeah,
And they could be someplace else, and the judge could be here. But we'd provide, if you will, a space and technology in some larger space where they could distance, and then, of course, that would be temporary when this is behind us, Lord willing, soon.
Yeah.
But
yeah,
maybe a year from now, or whenever it's going to be, then then that could also go the other way. I think in time we will solve the space problems here, but I hate for us to react, if you will, to the COVID-19 with a urgent solution for space in this building, when really I think that the thing that's adding this pressure is the pandemic aspect. And this will go away at some point in the future. We don't know when, but whatever the immediate solution is, if that to me sounds a little bit more implementable. That's the word I keep using, I guess. But something we ought to maybe take a look at is whether we could provide, if you will, a virtual meeting space for the other side. And our folks will still be in this building, but the person making the appearance might be someplace else. Just a
Something to
thought.
think about.
Okay, Judge, I don't think there's any other comments, so
Well, I
appreciate the
thank you so
update.
much for your time.
Absolutely.
And like I say, anybody else that would like a tour, we're happy to set it up and just let us know.
Thank you. And thanks, Ellen, for being here and all you
I
do.
would just mention, Chairman, there's, from a dollars perspective, there's money in the COVID, in the CARES money for courts. I know we are visiting with all of you this week, and I'm not sure if Tanya's done it yet or not, about the election office, which we all know is a piece of the puzzle to solve some of the court's issues and potentials to move them out to free up space. And then, of course, as Commissioner Howell alluded to, there's the administrative building. We've seen this train coming down the track. It's just that COVID has now expedited. The train's going faster. So we have some long-term solutions. We'll work with the judge and Ellen for short-term solutions to take care of their traffic need, but recognizing this is going to be in phases. So
Yeah, I see in our last proposed spending strategic plan that courts have a bucket of money. So thank you. Okay. Next up.
I wanted to go through, Commissioners, the dashboard very briefly this morning, and then Tim's going to follow me, and we can talk about testing. And I know several of you have issues on your plate you want to discuss in relation to COVID and COVID response. There's 4 slides on here that I want to just kind of highlight. This is when you bring up the dashboard as a citizen, this is the first slide you'll see, and it has a lot of information on it. It has the total number of tests done on a particular day. It has the total number of positive cases that come in a particular day, and then it does the mathematics of what the percentage is. And of course, any trend up on this slide would be viewed as negative. If you go back to the good old days of late May, early June, we were testing at a moderate level and had a very low percentage of positive tests that came about because of those tests. And you can see this is escalating. We are testing more, but our percentage of positive cases per test is increasing rather dramatically. So that's kind of an indicator of what is happening. Let me flip the page here. This is the one that got a lot of traction yesterday. You'll begin to see a trend line as we have these Monday meetings with hospitals. So we entered our 3rd data point yesterday. And it got a lot of traction because these numbers don't necessarily jive with KDHE or other types of hospital numbers, but this is information directly from the source at both of our public hospitals. And it's the total patients admitted with positive COVID cases is the top line, the blue line. You can see we went from 32 to 54 in a week. Patients under investigation are patients who they have tested for COVID, but they don't have the results back yet. Some are admitted, some are not, some are sent home. So that just gives you a total of kind of what's in the tank that could be admitted in the near future. ICU beds in use is a pretty good number. They basically tell us a finite quantitative number that we can enter onto the data screen. And then the red line, though, is approximate ICU beds available. And that is a very, I don't want to lead anyone to believe that that is an exact number, because it is not. There are staffing issues there. Both of these hospitals, including the VA, all 3 of the hospitals have capacity to morph and change as whatever the situation is in the environment that causes it to do so. In this case, COVID-19, they have the ability to modify and and change on the fly. They mentioned in the call yesterday, again, their main concern is a staffing issue, as it is for all of us that are trying to run organizations and businesses, keeping our people healthy, keeping our people away from exposure, where a mandatory quarantine comes into play. Those are all very critical elements right now. So this number that shows 8, there is more capacity than that. Wesley, for example, and Via Christi are already going into surge types of plans as these numbers increase. But all of them, to the person on those calls yesterday, we had a combination of executives and doctors. All of them are extremely concerned about the trend of what's happening with hospital population. This thing on the side, this moderate, that's getting ready to change to red if we have another week like we just had. Red indicates critical, to where they're in true surge mode. And it's stressing their staff to the point that they are concerned. So we'll wait to see what the next week has, and then we'll enter another data point. Can you, Kate, I'm having trouble. Can you flip me to, and this, of course, is just our testing map. Let's go to the next one, and then pass this one too. Okay, this is another critical graph. This is cases and recoveries, and you can see the gap that is growing. If you look again back to the good old days, that number was running almost parallel. You were seeing now that we're having more cases faster than we're having what we have defined as recoveries. And recoveries are symptom-free after a certain number of days, but what's unknown about COVID is what could be happening with people who even are recovering if they're having any continued symptomology. And that is, since it is a novel virus, we really don't have any data on that. You're beginning to see some anecdotal kinds of stories from around the country that are a little bit concerning, but we don't have any real data point on that yet, unless Adrian or Dr. Mins can fill us in. So, and then one more slide past that, Kate. This shows our active cases, and again, this is another key graph that we would look at as policy setters to determine how the infection rate is going. So unfortunately, I have to tell you, it's all bad news this week. Dr. Mintz put an order in last week that we use some of the tools in our toolbox now, which is distancing in space, gathering size, and masking. So we know that when we make any kind of policy change, there's a 2 to 4 week gap before we see results from that. So we should give that another week, perhaps, take a look at what the numbers are doing, and hopefully next week they're flattening and beginning to go on the decrease. So I just want to go through what the public is seeing out there and have you see it and talk about it publicly if there's any questions. And then I'd like Tim to come up and maybe talk about some testing challenges and what the latest update on our health center is as far as doing testing through the line. So, Tim.
Tom, Commissioner Cruz has a question
go ahead,
or
sir.
a comment.
Thank you, Chairman. One thing you didn't talk about was the type of person that is in the hospital. Did you want to touch on that?
Sure.
Turn on your
Okay. Commissioner asked about the types of person in the hospital demographically, and the doctors have all told us for the last week or two that demographically we're shifting younger. Our hospital population, which is 54 or whatever it is, was yesterday, and of course this is spot in time, so it could be a different number today. But they age range across the spectrum. They had 2 people admitted in the hospital who were in their 20s, some in their 30s, some in their 40s, some in their 50s, all the way 60s and 70s. Their oldest patient, I think, was 92. So demographically, the population in the hospital is diverse, and it covers all spectrums, and races and colors, creeds. It's a pretty non-specific kind of virus.
And the youngest patient under investigation was?
I'm sorry?
The youngest patient under investigation?
You'll have to help me on that,
Was
Commissioner.
1 year old.
Yeah. And I think our youngest positive test in the county was 6 months old. So children can contract the virus, and I mean, at least a few can, so.
I guess the one thing that you didn't touch on that I'd like to just mention for a second is the fact that Wesley had already taken some ICU beds out of commission for those folks who don't have COVID. So they've already decreased their ICU capacity for those who don't have COVID. They set up 10 beds, they're now at 13. So when you say that this graph is on yellow, yesterday I heard in their voice that it was critical. So I think that when we talk about this, we talk about it being moderate, but when you're already past your capacity and you're moving into surge planning already, plus your staff is down, that's important to pay attention to.
I think it's right there. I just remember several weeks ago when this first started in March and April, and we started these discussions with the hospitals. We were pressing even then for what's your capacity, what can you do, what's your surge availability, and there was a discussion of 100 to 150 beds that they could convert if pushed and pinned, that they could do, and so this yellow, red, green is qualitative in nature to the eye of the beholder. I do agree with you, Commissioner Cruz. There was concern in her voice yesterday, and the one thing that's different today that maybe was not the same 3 months ago when we were having these initial discussions is the pressure on staffing. Both hospitals have staff who have COVID, as do all of our our companies, our governments. We all have people who have COVID, and of course they're out of the work cycle then for at least 2 weeks, and nearby exposed workers potentially are out too. So that's the game changer here between now and a couple, 3 months ago is the staffing pressure. And we already had a little bit of a shortage of nurses pre-COVID in this community, in this region of the state. This is also, just like what the judge talked about, COVID is making that problem more acute and worse. So.
And you also didn't touch on McConnell.
Correct. McConnell, when we have this call on Monday, there's a number of participants. McConnell Air Force Base has been in from the beginning. They were historically, throughout this process, very latent in their reporting, not much problem, not much cases. But unfortunately, yesterday, the commander did report that they had, I think it was 25 cases on the base that they are having to manage, and actually have set up a temporary facility for those patients to convalesce and or get treatment. So anything else that we talked about that?
Okay. Commissioner Howell?
Thank you, Mr. Chairman. Just do some clarifications. So I did the math. Obviously, what we're seeing here is a capacity of about 35 ICU beds.
That was the number, when we started this data point 2 weeks ago, that was a number that both hospitals combined felt like they could handle. But as Commissioner Cruz mentioned, what happens is as the number of COVID cases increases, they will begin to take ICU beds away from general population. In any day, there's a number of ICU beds needed in the hospital.
So they have more than 35 ICU beds.
I believe that is correct, sir. They had these designated for COVID, and they're beginning to eat into the other ICU beds.
Could someone please provide a little bit of information as to what their ICU bed capacity actually is? I feel like that
It's
we need
35.
No.
It's 35. That's the number of beds they have available right now, currently, today. Why don't you believe that number?
That's not my question.
It's hard to get, and trying to answer your question, Commissioner, it's hard to get, a better number would be from the hospitals. What's your total beds in the hospital? How many total beds?
I'm asking for what's the total beds? How many of those are ICU capable? And what's the capacity relevant to that? When this started, we went into the stay-home order. We had restricted elective surgeries at that time. And they actually, if I understand correctly, they didn't really have a lot of work to do at that time. They actually laid off some nurses and some doctors, and they closed some facilities in our community. And now we're talking about just the opposite. They're overwhelmed. And so my question would be, maybe today's the right day to have the elective surgery discussion. I'm not sure it was right back then, but maybe today's that day. Anyway, my point would be this. I would like to know what the real capacity is. I know they have 35 beds they've designated for COVID-19 patients. But what's their true ICU bed capacity? That's the number we ought to have. Again, looking at KDHE data, if I look at the number that they provide on their dashboard and I divide it by 1/6, and say about 1/6 of the state's population here is here in Sedgwick County, that's a much larger number than 35. As it sits right now, that's 0.0035%. I'm sorry, 1.0035 beds per person that those hospitals provide service to. Back in March, we said that, we have 500,000 people in Sedgwick County, but these are regional hospitals, and so the real patient service is about 1 million people. And so if you do that simply, it's about 0.0035 ICU beds per person that potentially provide service to. As a Board of Health, that's the number we should have known a long time ago, if that's the right number. And so again, I understand that they're feeling the pressure. I get that. I'm not going to diminish the importance of this pandemic. This is obviously a serious situation. You say 54 admissions on the dashboard and 43 patients under investigation. Are those additive, or is 43 part of 54?
No, that would be in addition to the 54.
So it's 97 total.
There's 54 admitted. There's a certain number of PUIs, some of who are in the hospital, many of who are not.
And when they were under investigation, have they had a COVID test and we're waiting for the results?
That's correct, sir. Yes.
Okay. Do they have symptoms? That's why we did the test.
I'm going to assume yes on that because they went to the hospital. That they start at the hospital, usually in the emergency department.
I spoke to someone just yesterday, and I won't tell you where they were from, but they're working in one of the locations. They said that when someone has symptoms, they will send them home with a treatment, a regimen of treatment, okay, making the assumption that they're positive, but they don't necessarily follow up at that point. And so they leave them under the PUI category. Mm-hmm. I'm curious as to, these hospitals have the ability apparently to do a test and get results extremely quick. Unfortunately, Sedgwick County doesn't have that capability, but they can. And anybody who is admitted to the hospital as a COVID-19 suspected patient, I don't understand why they're under investigation unless they just haven't, unless the disease isn't detectable in their system yet. Maybe that's the situation. I don't know how, maybe that's what's going on here. But if someone gets exposed and they have symptoms, I assume that they would be able to be tested and have results that make sense. But
I can't comment on the hospital's capacity to test quickly. I will say that Wesley yesterday on their call said that they are also waiting. They shipped some of their testing out of state and are waiting 6 and 8 days to get results back. So I think that the lag in testing and timing, which Tim will talk about in depth a little bit, is a national phenomenon that's affecting everyone, including some hospitals. I will tell you that at a point in time yesterday, Wesley, I think of their number, maybe one of the hospitals, I can't remember which, that of their PUIs, 7 were taking up a bed in the hospital on general floor. So sometimes they take capacity in the hospital, sometimes they don't. And I hear what you're saying on the state type of analysis, but that's why we just cut to the chase and went right to the hospitals here. The 54 number as of 11 o'clock yesterday was golden. I mean, that was the standard. That's what they had in. And I think that that's important compared to the number the week before, which was 34. So that piece of data right there, there's no room for interpretation, or it is what it is. And so it's concerning to the hospitals.
And that 35 also does not include the VA, I guess.
The VA, and I'll ask our commissioners, I think they had 0 again yesterday. They have rolled through this entire thing with very few admissions.
My question is, this does not include their bed capacity, not how many
It
patients
does
they
not,
have.
sir, no. This is for just public hospitals.
And then I noticed on their dashboard, it says 121 new cases since the last update. I believe this was updated. This is a one day.
This is from
change.
yesterday,
Right.
2:45.
I guess my question would be, what's our positive rate right now when we provide these tests? It's around, what's our number today? Our positive number of positives we get when we do these tests, it's about around 10% right now still?
Yes, that was the latest.
So that would
data.
indicate we've had around 1,200 tests in one day to get that type of result. And we're seeing these numbers almost every day now. We've not done 1,200 tests in a week. So my question is, how are we getting such a high number of positive cases? Unless, can someone please explain to me how we got 121
Well,
positive
remembering
cases?
that,
We only have about 10%.
remembering, and I'll let Tim address this, but the health department just does a fraction of the testing in town. We've been running 20 or 25% of the testing in town. So positive cases are the community. So you're seeing these positive cases come up, not just from health department roll through, but from other providers as well.
Does our total number of tests indicate the community test
Yes, sir.
numbers? Okay. So how many tests were done, let's say, in the day or two prior to this update?
And that's a good transition time, Tim, to roll into testing, so.
I actually have another question or two. I can take that question in just a minute, but I'll take that question whenever
And
you're
I
ready.
can answer
Thank you.
from the
All
desk
right.
too. We'll let Tim have the podium.
Thank you.
Commissioner Dennis? Oh, are we done or not?
Thanks,
Commissioner
Mr.
Dennis
Chairman, I
had a question.
appreciate it. Well, Tom, first of all, thank you for the update on this. I appreciate it very much. I know it's very difficult to figure out how to quantify all of the different information that is available out for us to make a decision and for the public to see what's going on. I appreciate the effort that you all are making to get the best information that's available. I know that different people will look at the same piece of information and they'll interpret it differently, so we always have to remember that. The one chart that I do have a little bit of a question on, though, is the cases and recoveries. You're showing that it does not track very well here recently, and I guess I don't understand why that wouldn't track closer, because one of about three things are going to happen to anyone that gets that becomes a case. They're either going to end up in the hospital, and we see 54 or so. So that doesn't show why there's such a big gap, or they're going to get better, and the gap is bigger than that, or they're unfortunately going to pass away. And we've had 28 folks pass away. So I would think that would track closer, and I guess the only reason that could think that it's not tracking closer is the way that we're deciding whether or not that they've recovered from it. So in the future, I would think that solid blue line would start bending up, because as I said, there's only three things that I can think of that would keep them from not joining or at least tracking each other. So that's the one that I've got a little bit of a question on.
I think with that graph, and you're right, Commissioner, these can be interpreted however you want. That graph tells me that our infection spread is outpacing our recovery. I mean, that's how I look at that. And then recoveries are based on, when Adrian gets a shot at the podium, she can clean up anything I say wrong here, but the recoveries are based on EPIs calling people back and asking, how they're feeling, and when they get to a certain stage, when they are past, their symptoms are gone for a certain number of days and they're allowed to go back to life. They're allowed to go back to work and school or whatever they were doing. That is not a set number for individuals. Some people take a little longer, some people take a little shorter, and that begins to me, that line is rolling as it should. I interpret this that our infection rate out there right now is just moving at a faster pace than our recovery. But you're correct. I think sooner or later those should, again, they were parallel much of the time there, to where I think when the infection was not spreading at as rapid a rate, we saw this parallel line, and now I think that it's for a lot of reasons spreading faster than the recovery rate is happening.
Okay. Well, thank you, Mr. Manager.
Okay.
Bottom line is that I appreciate the information that you all are providing to us.
Thanks, sir.
And again, it can be interpreted different ways, and I don't want to detract from what you're putting up for numbers just because we disagree with the way that you've decided to put those numbers together. Thank you.
That's why thank you, Commissioner. That's why we're trying to give you multiple sets of data, so it's not just one thing that we look at. We have to look at the spectrum. So anything else before I give the podium to Tim?
Tom, Commissioner O'Donnell.
Thank you, Tom. So I was talking to one of our my city council member last night from Wichita, and they're all allowed to be on the calls, but yet we only allow 2 commissioners to be on the call. I think that's something we need to figure out.
Look at our lawyer here. I think yesterday
But either they're in violation of open meetings, or we can do it. I think we'd be under the same.
Yeah, there was, as far as I know, when we did introductions yesterday, they had 3 council people.
They said it was open to all of them.
Okay. I'll have to check with the city manager on that, sir.
Yes. That'd be great.
So was Blue Ball on the call?
Yes.
So you heard all these numbers?
I'll talk to the city manager.
Anyway, thank you.
Okay.
Okay.
Anything else?
No, that's it.
Good. Tim?
Thank you. Morning, Tim.
Morning, Commissioners. Tim Kaufman, Deputy County Manager. I'll run through some testing information and then pick up any questions, or as we go, if you've got questions, please let me know. Health Department took 904 samples last week. Most of those were through the drive-through sampling site. After operating the drive-through sampling site today, they will break that site down and they'll start moving equipment to the new site at 620 North Edgemore. They'll be doing setup tomorrow and they'll resume sampling on Thursday at the new location. Mobile outreach team collected 173 samples yesterday in Valley Center, and we'll continue to operate that across the community as well. We've made a great deal of progress over the last 7 days in terms of contacting people about results, and we're now within 48 hours on results for individuals after we get the results back from the lab. We've talked multiple times about some of the challenges that labs are facing nationally, and one of the labs that has been in the news the most is probably the biggest lab, and that's Quest, and we've used Quest as well. Right now, nationally, they're looking at a minimum of 8 days to get results back, and so because of that, we've stopped sending samples to Quest. There's a regional lab in Kansas City that we're using. We're in the process of finalizing the details to utilize a lab in South Central Kansas, since we should be sending samples to them by the end of the week. And then we continue to use the KDHE lab as well. And staff have submitted to CARES a funding request, or they've submitted that to finance related to the acquisition of 2 testing instruments that would give us capacity within the health department to process more than 500 samples per day in an 8-hour period. And so depending on how many samples we had to deal with and how we were able to staff it, we may be able to do more than that as well. So we'll run that through the financial approval process and hopefully execute that order as quickly as possible. We're working with the CARES consultants, Whit O'Brien's, to develop a data set of questions that we can provide to 3 different entities that have discussed increased testing capacity and a couple of them high-speed testing methods. Once we get that question set, we'll share it with those 3 entities, get that back, and then we've got we'll have a consistent format of information that will use some external assistance to evaluate those different proposals and see whether or not see what kind of a high-speed testing option may make sense for our community. And the health department also continues to monitor different changes in the testing world to see if there are other options that we can implement. I just read something this morning about a partnership between 3M and one of the large lab companies related to antigen testings that they think they can generate 1 million a day. So that's great. It's a huge number, but if we're going to test everybody, it's 300 days, 360 days to get our numbers covered. So I'd be happy to answer any questions about testing as we go, but the news that I shared, I think, was a little better than what Tom shared today. So be happy to answer any questions.
Thanks, Tim. Commissioner Allen, did you have some questions?
Yeah, just thank you for the presentation, and just to follow up, this says right here, people tested 1,310 new. That's a daily update. Can we confirm that's how many people were tested to create the 121 new active cases? That's a 1-day update.
Those are the results that came back that day, and that would be from across the community, all the different testers. And we've tested somewhere, the health department is responsible somewhere between 18 and 24, 25% generally, depending on what's going on in the rest of the community.
I mean, overall, that's a pretty good number, and I'm impressed with that. Unfortunately, this dashboard, and I don't know if there's something we can do to this to make this a little more usable, but it'd be nice to be able to go back a day or two and see. In other words, when I get this data, I can get the data for today, but once I go to tomorrow, I can't see today's data anymore. It goes away, and I have no way to go backwards a day or two and see what it was. And so I guess I could take a picture of it each day or something like that. But it'd be nice if there was a way to pick it, off a calendar, pick a date, and you can see what the data looked like on a specific date. Archive, if you will, an image of these would be very helpful. 1,310. That's a nice big number, and I'm just surprised that there's that much capacity in the city. that we can do that many. That's really good, really great overall. Since we did 904 on our drive-through last week, that's, let's say, at most about 200 per day. So if we're doing 1,300 in a day, that's a pretty big number. Just wanted to confirm that.
Commissioner, let me get a clarifier. Are you talking about the left-hand column that you'd like historical data on?
I think all of the bins of data, it'd be nice for us to be, maybe even a table format would be fine. It doesn't have to be this exact graphical format, but some way we can go back and say, on a date, here's the numbers we had for that date. So that we could,
Okay.
for those of us that like to do data analysis, it'd be fun to go back and see how, make our own trend lines, make our own graphs, that type of thing. But it's hard to do that.
Is this the slide that Kate has up, is this not getting you where you want to get as far as analysis of trend?
As the case each day.
Well, for whatever reason, that doesn't work on my smartphone. I don't know why. But, okay. Maybe on a PC I could do that. Okay. How many tests did we have yesterday?
Back page.
So he says people tested, not 1310, the day before that. What was the number of people tested the day before?
Right, okay, if you put your cursor on each graph, it'll give you the date. There you go. And there'll always be a one-day lag on that graph because today, what we're testing today will go up at the
All
end
right.
of the day.
There's hidden things on there. I appreciate the education here on the tests, on the
That's the reason we do
dashboard.
it, sir.
Pardon me?
That's the reason we're going through it.
Yeah, very good. Thank you very much.
Commissioner Dennis.
Thank you, Mr. Chairman. Well, one thing I want to bring up today, I had a discussion this morning with Dr. Randy Watson, who is the Commissioner of Education for the state of Kansas, and their State Board of Education is meeting today and tomorrow. And we all know that 20% of all the students in the state of Kansas are right here in Sedgwick County. So I asked him what kind of funding that they've received so far, and the only funding that school districts have received, and he's going to give me a breakdown by school district, but the only funding that they've received so far is from the COVID fund that they got. And so we'll have that figure. They have not seen any of the spark money, from what I can understand. And the biggest concern they've got right now is how are they going to open up the schools safely here in another month. And when I'm talking about schools, I'm talking about not only the students, but also the faculty and everyone else that has to be in that school. How do we protect all of those folks? I know we've got a bucket of money for education. I've always felt a little bit unease about the number of size of that bucket that we've got for education right now. I've received two different emails from superintendents in our county that are interested in using some of that funding, and I've referred them both times to the manager and to Lindsay Power. So, but I have it's kind of I'm ill at ease right now on where we're at and where we're going to help the schools and these districts being able to open safely. So we're going to get more information. I know that with the state board meeting, I'll get some feedback from that as the days go on here in the next couple of days. He did say that he talked to the governor yesterday, and the governor is concerned about how that we're going to get schools open. So this is a big issue for us. I think it's one of the major issues that we're going to have to face is what's going to happen in the next 2 to 4 weeks. And that's really the reason that he called me this morning, is he wanted to know what Sedgwick County is looking at in 2 to 4 weeks, because whatever we do is going to have a rolling impact directly on the school districts. So I didn't have very good information for him. I felt kind of ill at ease during the conversation today because I can't foresee the future. So one thing that I think that we're going to need to do here in the near future, I know that I've been on 2 different conferences with the superintendents. I know Tim has been on it, the manager's been on it. I think in the very near future we need to get another one of those meetings put together so that we can hear what their concerns are. As we go forward, we're going to start allocating this money. We need a better idea of what exactly that the school districts need. So I hope that we could get together with the superintendents in the very near future with our experts on the line and start figuring out what we think is going to happen in 2 to 4 weeks so that we can give them better guidance. Thank you, Mr. Chairman. I appreciate it.
Commissioner Cruz?
Thank you, Chairman. I wholeheartedly agree with Commissioner Dennis. That's why I had the call that I had last night with my advisory board. I asked Lindsay that same question. She sent me a list of all the district allocations for it's ESSER CARES funds. And so I'll send it to all commissioners so that you'll know exactly what district received what money. I feel like we have got to make sure, and that's kind of the reason why I was asking about courts today, because $6 million allocated to courts, but only $2.5 million allocated to schools. And I'm not saying that we need to pull money from one, but how are we determining what's the most important thing? And I spoke to my friend who is an 8th grade teacher at Pleasant Valley, where my daughter's going to go next year. And in any one day, she could see up to 75 students. That doesn't include ancillary, staff or the students in the hallways that she could be exposed to. And then what happens when parents, because I know that it happens, parents have to go to work. And so will they send their kids to school knowing that they're positive? Will they do, this is a really trying time for a lot of folks. And I'm not saying that people necessarily want to do those things, but that's the reality of the situation that we're in. And I have to wholeheartedly agree that I feel like our bucket of money for schools is not enough. And I would be an advocate for making sure that we do what we can for schools to ensure they have what they need to safely open.
If I could add to that, the commission should not forget that we were pointed out last week the unaddressed needs, and I think there's at least 2, if not 3, local representatives on the Spark Commission. And again, we're 17% of the population. We are 20% of the students, and I'm not sure that just us as the 5 and us county need to. We're addressing it, but we can sure use our help to talk to the Spark Committee and make sure that we're represented with funding at the state level, either testing, funding, everything about it. So let's don't lose our eye off of some of the additional availability. So anyway, Commissioner O'Donnell? No? Okay. Okay. Thanks, Tim. I think that's next.
Well, the commissioners raised some pretty good questions about school, and I guess let me just give a comment, and I might have to have Tim go back to the podium. But at this point, I think the state needs to give us an overarching plan on education in the state of Kansas. We're all kind of in the same boat here to some degree. I think the urban counties maybe have a different challenge than the rural counties, but we're all in the same boat of trying to get our schools open. So it's good that we have historical levels of, we know what CARES funding they've received. The state has yet to give guidance on what the Spark money is going to be used for regarding education. We have a certain bucket in our local dollars of CARES dollars, which you have control over. And if we want to move that money around, we surely will. But I think there has to be some guidance from the state on a state overarching plan, and then we can modify it to the local level based on what our districts need. And we go back to what's at our disposal. Because rapid testing, which Commissioner Dennis and I have had lengthy discussions about this in the past, that clearly is a part of the solution. Rapid testing would be great. If we could snap our fingers and have it tomorrow, that helps a lot with getting kids back in the school and getting businesses to stay open. That is not reality. We are moving toward that. It's a 60 to 90 day planning process. We'll have information to you all by end of month, and you can give us a direction of which way you want us to head on that type of rapid testing response. But until then, we only have the tools that we have, which is spacing and masking and cleanliness and staggering and minimizing populations, and that's where we're at today. So I'm rehearsing my answer for the schools whenever we have the meeting. We use the tools in the toolbox to the best of our ability for the short term with one eyeball on rapid testing, which will help considerably. And then another thing we need to be cognizant of, and I know you all catch social media and you're watching national news, there's a lot of talk about vaccine by December or January. How does that unfurl? How does it roll? How does it impact schools and businesses? So there's a lot of moving pieces that in our discussion with schools commissioner, which we'll set up, I think we need to have these discussions. But the shorter answer is for August, that we use the toolboxes, the tools in our toolboxes to the best of our ability to try to get these numbers to change. Nobody's comfortable with the numbers going the way they are. Schools, businesses, we're not, you're not. We have to do something to try to get these numbers to change, or at least settle. And we made a cognitive effort. I think Dr. Mins made an effort last week to try to change that. We'll have to give it a little bit of time to see how it shakes out. So we'll help them. Hoping for some guidance from the state, but I just wanted to comment on top of, we're all frustrated with that.
Thanks, Tom. Commissioner O'Donnell has a comment? Question?
Thank you. And yeah, Manager Schultz, I think you're right. And we've all been talking to different people in the education field. I mean, Commissioner Dennis went straight to the top. That's something that concerns all of us, both for the children, for their mental health, and then also economically. So many single-parent households in Sedgwick County, predominantly in 259, that being such a large school district, our economy can't work without parents being able to have their kids in school. So I know that's something that we're all extremely concerned about. And I think what is more unique, even though both public schools and the courts are both state functions, I believe that our friend Judge Gearing worked with our committee and us to come up with where that funding was. So I don't think that $2.5 million is at all what we're limiting schools to. I think the $6 million is just what the court said they need. Is that correct?
That's correct.
That's where we came up with that. So there's no limit to what we're going to spend on schools. And I think a lot of that $25 million that we have earmarked is going to go towards testing for schools and stuff. So anyway,
Rapid testing helps everybody.
Unequivocally. So thank you.
Commissioner Cruz?
I think one thing that we haven't talked about, though, is what happens when or if these tests or these cases don't drop. What is Dr. Mins prepared to do? What is this commission prepared to do? You know, we only have so many tools in our toolbox, and if those tools don't work, I think we should be realistic about the cases that are increasing and how we get them to drop if masking isn't adhered to in our community. Can you speak to that? Has anybody had a conversation with Dr. Mins about rolling back to, I mean, I don't want to shut anything down, but I want my child to go to school and be safe. You know, as a single mother here in Wichita with a child going to Pleasant Valley Middle School, I want her to be safe, and I want all of her teachers to be safe and all of her friends to be safe. But the reality of the situation is we're going to send thousands of children back to school, and we shut school down when our cases weren't even as high, and now we're trying to send them back. So I'm very concerned about my child. I'm very concerned about the rest of my teacher friends. I'm concerned with the paras, the administration of these buildings. And we've got to start thinking about what we're going to do as the Board of Health if these numbers don't decrease. I think you all know that I'm pretty prepared to make a hard decision, but I wonder what the will of the commission would be if these numbers don't decrease.
Well, I've had discussion with Dr. Mins in the past. Tim and Adrian and I all have. And when this discussion started a week ago, he was contemplating a phase 2. He ended up settling on a phase 3. And this is an interesting government question. which is how much regulation do you put on to solve the problem? And you want to put just enough regulation on, but you do not want to overdo the regulation, because when you overdo the regulation, there's side effects of that as well. So I think what Dr. Menz is trying to do the best he can, I know that you all try to do as best you can, is what's the proper regulation which allows us to get back to school, allows us our economy to grind, and allows people to have as normal life as possible while we're in the middle of this story, which is coexistence with the virus, as all of you brought up. And I think that is, and it's a slow-moving boat. So policy changes today cannot be visualized until a cycle or two of 14 days happens, and then we understand what we get. So
And
I
school
think
starts August. I mean,
I understand.
so the decision that we make today, it's going to be 2 weeks from now. So if we wait 2 weeks to make a choice, this is a really hard decision. And I would ask each commissioner to take, look at this data that's presented to you, and the hospital calls themselves are alarming. I mean, when you think of healthcare issues don't go away just because we're in the middle of a pandemic. I mean, if we're going to put our hospital system in a position of, okay, this person needs an ICU bed, but they don't have COVID, we're only allowing COVID patients to have ICU beds. Are we going to put them in that position? I mean, these are the questions that we really need to be thinking about. Now's not the time to sit back. Now's the time to take action and make sure that our community is safe. That's our job as public health officials. I'm done. Thank you.
Commissioner Howell?
Thank you, Mr. Chairman. Just, I don't know if anybody can answer this question, but on the dashboard, it shows we have 299 cases that are ages 0 to 19. And I understand all of the bins are 20 years. And of course, the last bin is 80 plus. Is there any way we can break that down? Because I'm wondering about some of the information I've read regarding, I read this from, I think, Academy of Pediatrics as well as the CDC. They're actually recommending that the detriments of not starting school is harsh on children, because there's a lot of helps that children get by going to school, and I don't have to go into the long list of things that schools do for children, but there's a lot of things that children get from school that not going to school may be detrimental to them. And in fact, I think the CDC, what I read recently was the CDC is recommending that ages, elementary school age, should be exempt from the mask mandate. In some states, that's where they've drawn the line. Elementary school age children are not, at least, again, I don't know what the science is behind it, so I'm asking for someone to provide the science. Whether or not age 5, as Dr. Menz has outlined in our local order, versus what I'm seeing in other states, age 11, I guess, and below would be exempt, because the demographic needs to be broken down a little bit further. I don't know if it's something we'd like to maybe research that a little bit and find out if that makes sense here. But there are consequences for not starting school, much like there's consequences of having a stay-at-home order. There was people who had deferred medical, that the consequences of that was detrimental to many people who should have gotten medical help and did not get that help that they should have had. And so some of the things I've read recently said that school should be started regardless of what's happening in the adult population, because the risks for children in COVID, although there are some risk there, the risk of them not going to school is worse, is what I'm seeing. So I wish we could break down that 299 into something that say, age, break it down into how many of those are age 0 to 11, or if that's possible to do that. And I guess I'd like to ask the question, why, we don't like the one-size-fits-all big government solution. Maybe we have a lot of school districts in our county. We have a lot of schools in our county, a lot of other elected officials. And I think maybe the solution maybe shouldn't stem from the county commission. Maybe the solution should stem from the school board or at the superintendent of the schools or or maybe at a facility, based on what's happening at that facility. It may not be the same thing for every place across the entire county. So I don't know, we ought to make the policy for what should happen in Sedgwick County for all of these students and all of these schools when we have other elected officials, and I think that you could tailor to some degree what needs to happen in each school. Let them be innovative and adaptive to figure out the right answer for that school. Thank you.
Okay. No more lights, Tom?
I guess all we had, sir, unless there's any other further health questions for Adrian, she's also here, so.
Okay. Well, if I could just make a couple of comments. I can't overstate that I think our commission can do some efforts on the Spark Committee. I think they issued, if I recall, $400 million on their first tranche of the billion, and we got $9 million of it, and we are 18%. 10% of $400 million is $40 million. So we have a task to do that is very tangible and has positive outcomes. I also point out that a couple of facts is that our deaths has stayed at 28 since June 25th. I looked at quickly, again, we're 18% of the population, but we're about 10% of the cases, positive cases, and out of the 28 deaths, we're 10% of the 280 plus statewide. So as a community, we're doing fairly good work, but the trends are not looking nice, and they're trending upwards. Another challenge that we have is that in the hospital call yesterday, 5 patients were out of the county, and on one, and 20% of 28, so there's another 5 patients. There's 10 patients of these numbers are from outside the county. And we are a regional medical center, and Via Christi and Wesley do a fantastic job as a regional medical center. But in our region, the 4-5 adjacent counties do not have any kind of order in place. So we are taking care of our neighboring counties, which is what the regional hospital effort's for. But I cringe a little bit that we're trying to do with Dr. Menz what we're trying to do in the county, but you can cross the county line and it's not. And we do have people back and forth. I know at one time we did an impact study of how many workers come in from outside Sedgwick County. This is when I was over at the city, and there's quite a number of workers come into Sedgwick County every day to come to work. So we have a challenge, no question. And so I plan on working with Topeka strongly in the next days, as I talked to Tom this morning about that, and we got challenges ahead. So we'll keep working hard. So with that, what are we adjourned, Tom? Okay, all right. Thank you, commissioners, for your comments. Wait, Commissioner Dennis, I guess.
Sorry, I need to change subject if we could. All of the commissioners have been getting some emails about the NACO conference. I'm sorry. All of our commissioners have been getting information about the NACO conference that's coming up. I did send some emails back and forth between the manager and Papoon and the chairman yesterday about it. I thought that there was a registration fee that we were going to have to pay whether or not we attended or not. The bottom line is that there are some votes that are going to be coming up during that session, and there is no registration fee, first of all. I want to make sure everybody's aware of that. But the KAC has asked whether or not that we could get, they could get our proxy to vote because Kansas needs to be represented at the NACO conference. I don't have a problem with that, but the issue comes is that we would have to have an off-agenda item tomorrow during our meeting to appoint one of us as the representative, and then that representative could then give the proxy to KAC. So the reason I'm bringing it up today is I don't want to shock everybody tomorrow if I bring up an off-agenda item to ask someone to be appointed from this commission as the representative to the NACO conference. And as I said yesterday, when I was thinking about dropping it, I thought we'd have to pay whether we win or not. The fact is, we don't have to pay, so my recommendation is to have an off-agenda item tomorrow, if that's okay with everyone.
Okay, good point. I'm over that. Okay. No other comments, so we will stand adjourned. See everybody tomorrow.